Mr. Patrick Tay.
Question 28.
The War on Diabetes was launched in 2016 to mobilize the whole nation to tackle diabetes. Since then, we have made encouraging progress across prevention, early detection and management of the disease, but much more remains to be done. For more effective prevention, we need to tackle risk factors such as unhealthy diets and inactive lifestyles. The Health Promotion Board, or HPB, has been working with industry partners to expand the coverage of its Healthier Choice Symbol, or HCS program, and the Healthier Dining program, or HDP. There are currently more than 3,500 HCS products available across 100 food categories, and their sales have been growing at 9% annually. As for the HDP, with more partners coming on board, 50% of the stalls across all hawker centres and coffee shops now have at least one healthier option in their menu. To encourage food manufacturers to innovate and reformulate to produce healthier alternatives, HPB has extended the Healthier Ingredient Development Scheme, or HIDS, in 2018 to 3 additional product categories, namely sugar-sweetened beverages, desserts and sauces. Since then, 11 suppliers have tapped on the grant to produce 62 lower sugar products, helping to improve the availability of healthier options across retail and dining outlets. There are early indications that these efforts are producing some results. For example, more Singaporeans are becoming more physically active. More than 800,000 Singaporeans participated in Season 4 of HPB's National Steps Challenge, 4 times that in Season 1. Based on the 2018 National Nutrition Survey, our diet quality has also improved. Singaporeans are consuming more unrefined carbohydrates. Unsaturated fat is displacing saturated fat, which has decreased to 36% of total fat consumed in 2018 from 38% in 2010. However, sugar and salt intake are still causes for concern. Our daily sugar intake remains high at 60 grams, with drinks, in particular pre-packaged drinks, being the largest single contributor of sugar. The average daily salt intake was 9 grams in 2018, with 90% of Singaporeans exceeding the recommended intake of 5 grams per day. In November 2018, the government decided to form a Healthy SG task force to further promote healthy living and activate the community to support the efforts. The Healthy SG task force has recommended several initiatives, including the adoption of technology-enabled personalized coaching solutions and a lifelong virtual health booklet for individuals to track their personal health status. We will also implement a support program for lower-income families to help them stay healthy. Early detection of diabetes is important, and we encourage Singaporeans to go for regular age-appropriate screening and follow-up. To make screening more convenient, MOH has enhanced the Screen for Life, or SFL program, and recently adopted non-fasting tests which facilitate opportunistic screening. More than 65 Singaporeans have benefited from cardiovascular and cancer screening in the 18 months following the enhancement of SFL subsidies in September 2017. This is almost 30 times higher than the number of Singaporeans who have come forward for screening over the preceding 18 months. We've also made efforts to enhance the management of diabetes and reduce related complications. For example, we formulated a national strategy to reduce lower extremity amputations among diabetic patients through timely detection and clinical management. More recently, MOH issued an appropriate care guide on food assessment in people with diabetes. These guidelines help healthcare professionals better perform comprehensive food assessment and treat diabetic complications in a timely manner. We've also been conducting more local research to understand the effectiveness and impact of our interventions. For instance, PREDICTED, which stands for Pre-Diabetes Interventions and Continued Tracking to Ease Out Diabetes, is a research program by Sing Health to evaluate the effectiveness of a community-based intervention program in reducing the conversion rate from pre-diabetes to diabetes. Data from this study can help us develop evidence-based, scalable, and effective interventions for better clinical management and policies. While there are early signs of progress in our war against diabetes, we cannot afford to let up our efforts. Many of these initiatives will only achieve the desired health outcomes in the long term. The government will continue to work with key stakeholders and partners in the public, private, and people sectors to sustain our efforts in this war.
Mr. Tay.
I thank SMS for her answer as well as update to this House. I'm aware that in Khoo Teck Puat Hospital, there's actually a group of clinicians who have done quite a bit of very good work in the research into prevention and better management of diabetes cases. I'm suggesting whether MOH can consider whether our public healthcare clusters, possibly in partnership with the Yong Yew Lin School of Medicine or Lee Kong Chian School of Medicine, to develop a dedicated research center to look into areas to better prevent, manage, and overcome and also win the war against diabetes.
Let me thank the member for his very useful suggestion. Indeed, I agree with the member that research is important to inform clinical management and policies, as well as for an effective war on diabetes. Currently, there is a fair amount of collaborations among researchers and clinicians within and across the healthcare, academic and research institutions on diabetes, with funding from various sources since war on diabetes. This includes the GUSTO study, which is a collaboration between A*STAR, KKH, NUHS and NUS, as well as the PREDICTED study that I mentioned earlier, which is between Sing Health Duke NUS Diabetes Center with HPB and the Singapore Clinical Research Institute. And in fact, there are also two research collaborations that have just been funded through the NMRC Open Fund Large-Scale Collaborative Grants. So I think that because there is currently sufficient research focus on DM locally, both in small and large-scale research, a current state mapping of the research landscape for diabetes will need to be done to understand the range of research that has already been funded and to ensure that the full potential of any research center to be set up could be achieved without significant overlaps, especially with the large-scale research projects that have already been funded. And also, as the researchers for these projects often come from multiple organizations, academia as well as the healthcare clusters and so on. Actually, we could take this to be akin to virtual centers of diabetes research, which taps on the best researchers from Singapore. But nonetheless, we will further study the member's suggestion and to see how useful and appropriate such a dedicated research center would be.
Dr. Chashilu.
Just two supplementary questions for the SMS. I think first, I just wanted to ask whether the ministry has any ideas to perhaps increase either subsidies or further funding support for patients with diabetes. For example, just to give an example, diabetes is part of the CDMP program, but not all of the chronic diseases are created equal. So I was wondering whether, since we have this war against diabetes, whether we could look at some package where there could be additional funding liberated, either from Patients MediSave or perhaps from other targeted subsidies for patients with diabetes, because this would probably help to increase compliance. The second supplementary question is probably related to my later question, but I think I'll just ask it here. We're all concerned to see that the sugar intake per day of Singaporeans, as of from a survey last year, is still at 60 grams, and WHO standard is 25 grams every day, so it's quite a big jump. So I was wondering whether the Ministry of Health has any targets. Have we set any targets for the sugar intake per day for Singaporeans, and do we have any timeline to try and reach these targets? Thank you.
Regarding the subsidies to ensure affordability of treatment for diabetes, just to note that we have just recently, for instance, allowed the test strips for diabetes for type 1 and type 2 patients on insulin to be under the CDMP. And that means that they can claim on MediSave, and it also goes under CDMP, through trust funding, for instance. So as with healthcare affordability issues, Ministry will continue to look into ensuring the affordability of treatment and access for the different conditions, including for diabetes. With regards to sugar, I think you know that we have undertaken a public consultation on the measures to be taken to reduce Singaporean sugar intake, particularly from prepackaged SSBs, which was just concluded in January this year. So we are reviewing the feedback. We received feedback from over 4,000 members of the public, as well as from the SSB and media industries. We will review the feedback, and we will also take into account evidence from local and regional studies, and then make our decision.